I'm Lauren.
I'm Audrey.
I'm Hillary.
And we're seniors in the Communication Sciences and Disorders Department, and we're going to be informing you about vocal hygiene and voice disorders.
Our goal in this presentation is to share information that will be beneficial in helping you to become aware of proper vocal hygiene practices and effects of improper vocal use. Voice is the complex product of vocal cord vibration that allows people to make sound and communicate using spoken language. Our voice is the sound that is created by structures in the throat that work a lot like any other instrument. When we exhale, we push air through two muscles called the vocal folds or vocal cords. It creates sound pressure waves in the air. This involves the vocal folds rapidly being pushed open by the flow of air from our lungs, then snapping shut again, almost like shuffling a deck of cards. If you are not using your voice correctly, this vibration can be one of the causes of injury to the vocal folds.
Some of the most common causes of voice disorders in adults include vocal nodules, polyps, laryngitis, carcinoma, and vocal fold paralysis. Vocal nodules are hard and rough, non-cancerous growths on the vocal folds that can be very painful. Polyps are soft, non-cancerous growths that can occur in one or both of the vocal folds. Carcinoma, or cancer in the vocal tract, can cause voice disorders as well, especially as a result of surgery. Laryngitis is inflammation of the larynx, which houses our vocal folds. And vocal fold paralysis occurs when one or both of the vocal folds becomes paralyzed. Voice disorders can have a structural origin, such as nodules or polyps, or have a neurologic origin, such as vocal fold paralysis or Parkinson's disease, for example. Voice disorders peak between the ages of 40 to 60 years old for adults, but can occur at any age. Incidence rates for voice disorders in adults are higher for women than men. There are several professions that are at a higher risk for voice disorders. Some of these professions include teachers and professors, vocalists, coaches, performing arts majors, or any profession that utilizes their voices frequently. There are several behaviors that can cause or add to your risk of developing voice disorders. These vocally abusive behaviors include talking in noisy environments, coughing or clearing the throat frequently, using caffeine products, drinking alcoholic beverages, yelling, screaming, or cheering, giving speeches or lectures without a microphone, spending time in smoky environments, or speaking loudly for long periods of time without proper breath support.
Vocal disorders can be prevented by the use of proper vocal hygiene strategies. Vocal hygiene is a behavior that encourages the maintenance of good overall vocal health. Some of the important things to incorporate into your vocal hygiene routine is hydration, pitch range limits, loudness sensitivity, and plenty of rest. Hydration is essential for optimal functioning of the vocal tract. The vocal tract is a cavity where the sound is produced and filtered. It is important to maintain proper hydration by drinking plenty of water throughout the day at room temperature. Roughly 6 to 8 ounces or glasses of half your body weight in ounces is recommended. It may vary based on the amount of exercise you partake in. Pitch range is also an important aspect in vocal hygiene. Individuals should not use a pitch range that is inappropriately too high or too low. This can put excess stress on the vocal mechanism. Loudness is a very strong component of the vocal abuse. This is especially important to keep in mind during practices and performances like step sing. Make sure to avoid yelling, screaming, or singing louder than normal. This can contribute to swelling and altered voice production, which can result in laryngitis. It is important to try to avoid the tendency to speak at a loudness level greater than a noise environment around you. This can be challenging in a loud crowd, but using microphones can help control the loudness levels. As always, getting plenty of rest is essential to practicing proper vocal hygiene and overall good health. When one is fatigued, the natural loudness levels of your voice tend to be quieter. This can contribute to someone putting extra strain on their voice to be heard. Practicing these tips can help benefit your overall vocal hygiene.
We hope you've learned something new about the ways to care for your voice and the negative effects that can occur if improper use is sustained over time.